East Riding Pulmonary Rehab team is a community-based respiratory team for the whole of East Riding. The main complaint of our respiratory patients is breathlessness, but actually when you look into it, they find that they're reducing their normal activities of daily living, so they become socially isolated and they can become quite depressed and quite anxious as well. The idea of the programme is to increase their activity, so they come along and do an exercise programme with us and then follow it with some education components of how to manage their disease, what it is, how to use their inhalers, things like that that'll make life easier for them.
We were already attending a course at another clinic and Bridlington was a little nearer, so we came here. It's fantastic. As I've said many times before to the commissions and everything, they've kept me going for 6 years. If it weren't for these girls and their techniques and their abilities, I just wouldn't be here.
I don't think you can do anything without a team, and I think the only way that you can actually ever progress a team, develop them, is for everyone to feel included and to actually have their say. For some of our patients, we do satisfaction questionnaires, and a lot of the stuff that comes out is that they don't think we could improve our service anymore. They think we're brilliant, but also, you've given me my life back.
We're an infection prevention and control team based in North Yorkshire. We produced our preventing infection workbooks for GP practices, care homes and domiciliary care. The preventing infection workbooks were brought about because we cover a huge geographical area. It's not always possible to deliver face-to-face education, and not a lot of staff actually like e-learning. It's divided into roughly 18 topics. For example, hand hygiene, standard precautions, MRSA. The workbooks help reduce healthcare associated infection by providing staff with evidence-based education so they can then apply the principles and what they've learned into their everyday practice. We've distributed approximately 70,000 copies of the Preventing Infection workbooks, which we're extremely proud of. We've had lots of positive feedback from GP practices, care homes and domiciliary care. As a result of the success of the workbooks are a dental workbook, which we're hoping will be out by the end of this year, and we're also looking at doing one for mental health. The team are extremely important to develop our ideas. Each member of the team is valued from the concept of our idea to the actual production. They all have a vital part to play. Everybody has ideas and they're all relevant.
The project team understand that their role is to create the time and space for good staff to deliver great wound care. There are over 400 different types of dressings. Obviously this causes challenges. There's inevitably waste. The thought was that by rationalising this, the advantages would include a cost saving for the trust, enabling the nurses to locate the correct dressing more easily. It would also save storage space upon the ward. From a wound point of view, we are focused on the patient in providing the optimum care, and this includes providing the right dressing for the right type of wound for that patient. By doing this, we can enhance the healing of the wounds. We can shorten the patient's inpatient stay, so it's got advantages for both the patient and also the healthcare trust. Members of the team have played to their strengths. The team's vision is to improve patient healthcare outcomes whilst improving efficiency. In terms of cost of dressings, the Trust spends £1.4 million per year on these. We, as part of this process, have reviewed about £470,000, so less than half, and of that we've achieved £175,000 of cost savings, so it's a huge amount of savings that can be invested in patient care.